For us, this is about a great day for science, a great day hopefully for Australians. Pfizer's proud that we are in a position with our partner with BioNTech to bring forward a COVID vaccine. This has been unprecedented in terms of the time frame. Last year, around this time, our CEO, Albert Bourla, stood up and said that we were going to use all our resources to find a solution in terms of a vaccine by the end of 2020. That has never been tried before, and it has been a significant effort on behalf of Pfizer and BioNTech, but governments, regulators, public health bodies, and very importantly, the participants in our clinical trials that have actually led us to this point where we are now on the verge of being able to bring our Pfizer vaccine Comirnaty to Australians to protect them against COVID-19 and hopefully start to see a pivot point in our approach and in fighting the COVID-19 pandemic.
Scott Morrison did say this morning that the rollout will be delayed by at least a couple of weeks because of production shortages. Can you explain to us the reasons for that delay?
Sure. So we are absolutely committed and confident that we're going to be delivering our 10 million doses to the Australian government over the period of 2021. We are still on track. The intention was around mid to late February, so we are still on track to deliver those doses, those first doses, within February. There has been a slight change in terms of how we're approaching the doses, and that's because we have had a huge number of requests for additional doses from around the world, and certainly that has scaled up even further after our clinical trials results came out showing safety and efficacy. And so Pfizer and BioNTech had committed to producing 1.3 billion doses by the end of 2021. That target now, in response to this dire need, is now 2 billion doses over the course of 2021. In order to do that, we need to scale up further. We need to retool our manufacturing facilities in order to have the capacity to produce more doses. And what that's led to is a short-term temporary change to delivery schedules. We expect that to have worked its way through by mid-February, and by the end of Q1, we believe that the balance of those doses will be addressed.
So does it mean that Pfizer, in the end, because it did come up with the vaccine first, has decided to spread the available vaccine to more countries than had initially been planned for?
So back in March, when we made this commitment to bring a vaccine to fight COVID-19, we already started to have conversations with hundreds of governments across the world, and also including the COVAX facility, which is there predominantly to procure vaccines for low to middle income countries, and we have committed to 40 million doses to the COVAX facility. So that already had occurred. We are continuing now these conversations as we have additional capacity to understand what are the specific needs of countries. We recognise that this is very dynamic. Countries, the positions that countries are in, the decisions that they have made is changing on a daily basis, and their needs are changing on a daily basis. Our perspective is that we are here to try and increase the capacity of our available doses so we can continue those conversations and make them available to meet the needs of the individual countries, including the Australian government and Australians.
And so what is the opportunity for Australia to buy more of the Pfizer vaccine?
So we're at this point where we're scaling up. We are looking at the potential availability and of how many doses will be available, and we are going to start those conversations with governments around the world. And we certainly will be continuing our dialogue with the Australian government to understand its particular needs, and we anticipate that in the coming weeks.
How does Pfizer balance the demand with the available supply? Do the countries with the biggest pockets get first access?
Pfizer's absolutely committed to broad access for our vaccine, and that includes not only high and middle income countries, but our commitment, as I said, to low and lower income countries is absolute. And that is demonstrated in our commitment to the COVAX facilities. So our intention is broad access, and also our intention is in those discussions with countries that the consumer, the people, should not be paying out of pocket.
Because of the logistics in delivering this specific vaccine, are rich nations more easily able to satisfy the storage requirements necessary to ensure its safe distribution?
So we understand that this is a slightly different vaccine. It does require low temperature storage, low temperatures in storage and shipping. But what we have already started to have conversations around the world, and we are shipping right now to a variety of countries. So that's across the Middle East, Europe, America, and we expect that will continue. So we are here to support governments around the world. And equally with the COVAX facility, we expect that will be distributed to many, many countries.
You have mentioned areas with great resources. Is there specific assistance for poorer nations to distribute this vaccine, say Australia's neighbours in the South Pacific?
So my understanding for right now, I'm not clear on the exact discussions that are happening with our Pacific neighbours. I understand the Australian government has spoken about that. The COVAX facility is also there, and we will continue to have conversations with different groups that also cover the Pacific Islands.
Now, your vaccine has been approved for people aged 16 and over. Do you expect it will soon be approved for children and teenagers?
So there is an additional cohort that we are now investigating, so from 12 years and above. And when we have that additional information on both safety and efficacy, we will continue to provide that to all the regulators and including the TGA.
Is it Pfizer's advice that the vaccines should be delivered 21 days apart? And if they aren't, as we are seeing in some countries right now, would you expect that there would be an effect on the efficacy of the vaccine?
So our clinical trials had a period of 21 days between the first dose and the second dose. That information has now been shared with all the regulators. It now will become, in a pandemic situation, it is up to those countries, it's up to those guidelines to decide how they move forward. In terms of the labels, in terms of how the regulatory bodies are looking at this, it is based on that clinical data of a 21-day interval. But we recognise that every country is in very, very different circumstances, and they need to make a decision that they believe is right for their people.
And in terms of the effect on efficacy, if there is a longer interval between doses?
So at this point in time, the evidence we have, and there was some variability in terms of not everyone had it exactly on 21 days interval. We have shared all of that information with the different regulators. Unless we have further information from real-world data that perhaps gets collected, as we know, millions of people have now received the COVID vaccine from Pfizer. So perhaps that information will inform further guidelines and further actions that will be taken.
What's the best guess on how long it will take before the world's population, or at least as many people as would like the vaccine, receive it? What is your best guess on how long it will take to vaccinate the majority of the world's population?
Well, I have to say, to vaccinate the majority of the world's population, we expect that there will be many other vaccines that will come forward in order to do that.
Yes, but in terms of, clearly that there are hundreds of vaccines either in development or under development being researched right now. What is the best guess among the scientific community about how long it will take for the world's population to be covered by a vaccine?
I'm not sure whether I'm best placed to answer that. I apologise. From what we understand, given how the vaccines are rolling out, it is going to take some time. And I think what is important is that each and every single one of us continue to follow the guidelines by the Australian government in regards to the things we can do. So social distancing, masks, hand sanitizer. I think that is going to be critical whilst we, for some time before the vaccine our vaccine and many other vaccines are able to offer broad protection across the world.
And I understand that Pfizer is currently trying to accelerate its supply process, but is it working on what happens next? Are you working on a second vaccine? Will some people be receiving a different vaccine from Pfizer next year?
So one of the things that is really important to point out is this particular vaccine is a new technology, an mRNA vaccine technology. It's been studied for many, many years. In fact, Pfizer and BioNTech have been doing this with flu vaccines. With this extraordinary focus of investment of time and money, it has put the final piece in the puzzle for mRNA vaccines. And this particular technology hopefully has real value in the long term for the pandemic because it is more easily able to scale, particularly if there is a variation or a mutation in the virus. It has the opportunity to perhaps, the belief is that we should be able to retool and have another version of the vaccine much quicker than some of the other platforms. Also, I guess it's been shown, you can see now today with the TGA approval, the TGA being a world-class regulator, it has met the strictest and the highest standards for safety, efficacy and quality, and that sets it up, hopefully, this technology, it sets up very strongly for the pandemic, how it evolves, that we will also be able to evolve with it and meet the fight against COVID-19.
Anne Harris, Pfizer's Managing Director here in Australia. Thank you very much for your time this afternoon. Congratulations on being able to bring a vaccine down under.
Thanks so much.